Hey everyone, Prasanna here from Medax OSCE Academy. Let's dive into today's OSCE topic.
Step-by-step guide explaining what to do after CBT to prepare for the OSCE. Passed your NMC CBT. Congratulations. Now, let's get you ready for the OSCE exam with a quick guide. Understanding the OSCE. The first and foremost step is a practical exam with stations where you show your nursing skills, communicate with patients, and make decisions all under time limits. Knowing this makes the exam less scary. 2. Make a study plan. Spend 4 to 6 weeks practicing nursing skills, communication, and UK nursing standards. Break it down into small parts and follow your plan every day. 3. Practice your nursing skills. Practice your nursing skills like wound care and medication, safely. Use practice kits or videos. Keep practicing until it feels natural. 4. Practice your communication skills. Work on how you talk to patients. Use simple, clear words and SBAR for handovers. Role play with friends to get confident. 5. Perform mock exams. Time yourself and practice like it's the real test to stay calm during the exam. 6. Learning nursing values. Learn the UK nursing values by reading the NMC Code and NHS rules. This shows you care about patients and safety. 7. Join Medax OSCE Academy. Our expert teachers give you real practice and feedback, so you pass your OSCE with confidence. Thanks for watching. Visit Medax OSCE Academy to learn more and sign up. Good luck on your OSCE journey. If you found this useful, please like and subscribe for more OSCE guides. For personalized training, call us on 07865 235 335 or email info@medax-group.com. At Medax OSCE Academy, we turn stress into success. Thank you.